afternoon, dear colleagues. My name is Anastasiia Lapshyna. I'm aesthetic doctor and speaker of Innoaesthetics laboratory. Okay, so today we are discussing the polynucleotides, like the main ingredient of DNA PEPT-HA. And our main goal today is to understand how is it really working, what is the main advantages of such a combination like we have in DNA PEPT-HA. And also, of course, we will talk about the protocols which Innoaesthetics laboratory give you like a tool which you can implement into your everyday treatments. Because as you know, Innoaesthetics is not just offering a product. Usually we offer a complete concept and also the concept of treatment, like how you can use it in the specific technique or how you can use it in combination of different products. But before discussing that, let's see what we have in DNA PEPT-HA, what are the main ingredients and how they work. I think that DNA PEPT-HA we have for some time on the market, and I'm sure that you know this product really well, because even from the very beginning, when it appeared, all the specialists understood that it's some kind of a specific product. Because here we have really very potential and strong combination. A combination of polynucleotides with hyaluronic acid, with peptides, with glutathione. And of course, it makes the product really very effective. So as for the polynucleotides, I'm sure you've noticed that now we are witnessing like the second wave of the popularity of polynucleotides. Around 10 years ago, polynucleotides became very popular on aesthetic market. For us, it was something new because mostly we were using product based on hyaluronic acid. Classic biorevitalization was more popular. Mostly at that time, we were using hyaluronic acid like the main ingredient for biorevitalization, but polynucleotides were like the great alternative at that time. And nowadays we can see that it's like a second wave of the popularity of polynucleotides. Because nowadays you can see that there are a lot of publications in Instagram, a lot of publications in TikTok, a lot of celebrities are talking about polynucleotides. Mostly nowadays you can hear that they are referring to polynucleotides as to salmon sperm. But of course we understand that this is the same ingredient which we were using for years. And today, I'm sure that maybe there are more patients who know about polynucleotides because they can see it in the social media and they are going to have such a treatment. So let's see what are polynucleotides. On the market, you can see that we have polynucleotides, we have, you can see also polydeoxyribonucleotides. Mainly, of course, we understand that this is the same. This is the derivative from the DNA. Polynucleotide is something more common. Polydeoxyribonucleotide is something more specific when we are referring just to the part of the DNA. Mostly the source of the production of the polynucleotides that we have of the market is salmon sperm. Why? Because the human mitochondrial DNA is around more than 60% similar to the mitochondrial DNA of salmon. That's why mostly it is used like the raw material for the production of the polynucleotides. What also is important to understand that polynucleotide can be a signaling molecule and also it can be a structural molecule. A signaling molecule means that polynucleotides has the possibility to bind with the A2 alpha receptors in the fibroblast. It means that we will stimulate and activate the fibroblast for the production of elastin, for the production of collagen, our own hyaluronic acid. So this is the way how we can improve the quality of skin and how we can use polynucleotides as one of the main ingredients in anti-aging treatments. But also, polynucleotides can be used, let's say, in a simple way, like a building material. But actually, it means that polynucleotides can be the part of the salvage pathway or the rescue route. What it means? You know that during the proliferation of the cell, when the cells are dividing, we are obtaining two DNA from one DNA. So we had one cell, but from one cell we are getting two cells. It means that we need to build the second DNA for the second cell. And during the process of proliferation, polynucleotides can be used like a building material for this second DNA. Of course, not the whole polynucleotides, not all the molecule. It can be the source only after it will be cut into pieces by specific enzymes, which are called nucleases. So these enzymes will cut the polynucleotides into shorter parts, which are nucleotides, and then they will be cut into nucleosides. Then they can cut even more. So such kind of small molecules will be the building material for the DNA. It's also very important that they are used only in the step of the proliferation of the cell. So it means that it will not influence our DNA in any other way, which is also very important. So we are not talking about any kind of changes of DNA, any kind of mutation. And this salvage pathway, of course, is possible only when the polynucleotides will be cut into pieces. That's why here we again have to understand why we need to know about the molecular weight of polynucleotides. Is it really important? Do they have very high molecular weight? Do they have lower molecular weight? Do all the polynucleotides have the same molecular weight? If we are talking about hyaluronic acid, for example, we are used to know that if we have a syringe of hyaluronic acid, we can know the molecular weight of that hyaluronic acid, for example, 1 million Dalton, which means that all the chains of hyaluronic acid inside that syringe, inside that product, would be 1 million Dalton. So they are all the same. With the polynucleotides, it doesn't happen like that. All the chains of polynucleotides which will be in the product would be of different molecular weight. Mostly it would be from 50 kilodaltons again to 500,000 daltons or maybe 1 million. But the range is really wide. So usually we can say that the mid-range would be about 250 kilodaltons to 500 kilodaltons. But all of them are different. And again, they will start their work when they will get to the body and when they will be cut by our own enzymes into small pieces. The longer the chain, the longer time would be needed in order to cut it into pieces. The smaller the chain, the faster it will be cut into pieces. But the final point is cutted polynucleotide. So it doesn't work like a long chain. As for the stimulation to A2 alpha receptors, this is another way of working. This is the way of signaling molecule. So here we are talking about the stimulation of the growth factors. And here we are talking about the influence to the inflammation, because we know that we can suppress the inflammation during using of polynucleotides. And that's why polynucleotides have very wide range of indications. It's not just anti-aging. From the very beginning, when polynucleotides appeared on the market, this was the ingredient for the biorestoration. For the stimulation of the regeneration of the tissues. It also could be used in the case of, in every case of the aesthetic problems which are associated with the inflammation, like post-acne scars, like hyperpigmentation, regeneration and process of the formation of the scars. And that's why we can use it for patients of different ages. We can use it not just for the skin, but also for the trichological issues. So, of course, polynucleotides became one of the most effective and widely used products on the markets. Here you can see the main functions of the polynucleotides, the main indications why we are using that. As I've already mentioned, it can be the resolution of inflammation because we decrease the level of pro-inflammatory cytokines. It is a source of the building material during the proliferation of the cells. That is why we need polynucleotides in the case of healing processes, for example, in the cases of injuries, in the cases when we treat post-surgery patients, and remodeling capacity while talking about the stimulation synthesis of collagen. And this is on one side can be the anti-aging treatment. On the other side, it can be a great regenerative treatment, which we need in the cases of working with the scars, for example. There are really a lot of publications in the PubMed, which you can find, regarding the using of polynucleotides, not just in the cases of anti-aging treatments, also in the cases of the regeneration in the tissues. And we can see the stimulation of the regeneration, we can see the stimulation of the synthesis of collagen, of elastin, improvement of the tissues. And also there are some interesting publications regarding the combination of polynucleotides and hyaluronic acid. So mainly what we can see that the effect of the regeneration is more potential with the polynucleotides than with hyaluronic acid. Also, we can see that the effect of hydration would be more potential with hyaluronic acid, but it would be more effective, like, let's say it would be faster, because we can see the effect of hydration just from the very beginning. We are starting to use hyaluronic acid. Polynucleotides also will give us the effect of hydration, but the effect of hydration with the polynucleotides we can see a bit later, not just from the very beginning. And what is also very interesting that this effect of hydration can start longer. So the effect starts a bit like not from the very beginning, but it will last longer. And that is why, of course, it's better to use the combination of polynucleotides with hyaluronic acid, because these two ingredients, they are very potential regarding each other. Hyaluronic acid gives us the opportunity to see the effect rather quickly, especially when we are working with the patients with the wrinkling morphotype who have dry skin or dehydrated skin, who have deep wrinkles, who have problematic skin in the periorbital area, in the area of the neck, because the skin is very specific in this area. It's very thin. We almost don't have the fat tissues under the skin in these areas. So that's why using a combination of polynucleotide and hyaluronic acid can be even more potential than using hyaluronic acid by itself and polynucleotide separately. There are a lot of clinical studies showing the changing of the skin regarding the anti-aging effect. So it shows that using of the polynucleotides, even separately from hyaluronic acid, improves the quality of the skin. It's more smooth. The level of the wrinkles is lower. The depth of the wrinkles is lower. And again, you can everything find in PubMed. There are really very interesting publications showing the efficacy of PDRN. But polynucleotides is not the only ingredient that we have in DNA peptide. If you remember, we also have here the complex of peptides, glutathione and hyaluronic acid. First of all, we should not confuse peptides with polynucleotides. These are completely different molecules. For example, some of the patients, sometimes they confuse it. They think that peptides, it's maybe, or polynucleotides is the kind of peptide, or maybe it's the same. Of course, it's not, because a peptide is the complex of amino acid. So peptide actually is the huge molecule, which is built from the links of amino acids. And polynucleotide is the very small molecule, because this is the derivative of DNA. So you can imagine how small they are. They have some kind of different type of stimulation of the cells. Peptides are very specific. Polynucleotides are not specific. Polynucleotides, they or stimulate A2 alpha receptors, or they are the source for the new DNA. Peptides are more complex, are more difficult, and they are more specific. There are different peptides that can or stimulate some processes, or they can block some processes. So in the case of DNA PEPT-HA, we are using the complex of peptides mostly responsible for the stimulation of the synthesis of extracellular matrix and stimulation of synthesis of the collagen. So additionally, we are not just giving the source or the building material like polynucleotides. Additionally, we are using the peptides, which also will activate the growth factors, and that also additionally will stimulate synthesis of collagen. So we are like catalyzing the efficacy of polynucleotides. The other ingredients that we have here, apart from the peptides, would be hyaluronic acid and glutathione. I think that we had really a lot of webinars about hyaluronic acid. Every day we are working with hyaluronic acid, so it's difficult to tell you something new about hyaluronic acid. But we also know that the hyaluronic acid has both capacities, and this capacity is the signaling molecule and structural molecule. In this case, in the DNA PEPT-HA, hyaluronic acid that we have is not of a very high molecular weight. I'm sorry, I will return back. It's not of the very high molecular weight and not of a very high concentration. So here we are talking mostly about the moisturizing and hydrative properties of hyaluronic acid, but at the same time, this would be a great product for the patients who are prone to swelling. Because mostly when we are discussing the patients, we divide them into two main morphotypes of aging. There are 5 of them, but we are usually referring to wrinkling morphotype or deformative morphotype. And deformative morphotype is the morphotype which is prone to swelling. And we are usually selling that it wouldn't be a good idea to use hyaluronic acid for such patient for the biorevitalization, because this patient is prone to swelling. If we are adding hyaluronic acid, then we will stimulate the retention of water, especially in the periorbital area, for example. And for such kind of patients, we are trying to find some alternative. And usually for them, the best option would be the treatment with polynucleotides. We also get hydration, we also get stimulation, we also obtain really nice anti-aging effect, but at the same time, there is no risk of the swelling. The same we can have here. Hyaluronic acid is not of the high molecular weight or very high concentration. That is why here, additionally, it will work synergetically with the polynucleotides, stimulating their properties, but at the same time not causing any kind of issues which can be associated with the swelling. And another ingredient that we have here, which is of course extremely important, is glutathione. Glutathione is one of the most potential antioxidants. I'm sure you also notice that nowadays treatments with glutathione are extremely popular. These are like mesotherapy with glutathione. It can be taken like nutrition. It can be used with the intravenous injections and so on. Glutathione, really, why it is so effective? First of all, because of its capacity of detoxification, for detoxification of the body. But when we are working with glutathione as the mesotherapy ingredient, of course, we are not looking for the effect of the longevity, let's say, and we are not looking for the effect for all the body. What mainly we can see from glutathione, which we are using in a specific area, mostly that would be the effect of lightening. So glutathione is really very potential antioxidant, which will protect and prevent the oxidation of melanin, because when melanin is produced, it is still rather light. And then due to the processes of oxidation, it becomes more dark. So glutathione additionally will be the ingredient which will protect melanin from the processes of oxidation. And of course, at the same time, it will protect the cell from any kind of damage which can be caused by free radicals, for example. That's why DNA PEPT-HA is the product which will give you anti-aging effect, stimulating effect, improvement of the quality of the tissues, some kind of lightening effect. I usually say some kind because, of course, DNA PEPT-HA would not be the first product which you're gonna choose in the case of hyperpigmentation, because first we will start with the peelings with retinol. Talking about mesotherapy, we would start with the complex of antioxidants like restructurer, for example, where we have not just glutathione as the main active ingredient. But additionally, while working with DNA PEPT-HA, you always will see some kind of lightening effect. Also, it can be used in the case of trichological issues. So if we need to stimulate growth of the hair in the case of different types of alopecia, DNA PEPT-HA can be used. It can be used in the cases of post-acne scars. It can be used in the cases of stretch marks. So as you can see, there are really a lot of problematics that can be closed with the help of DNA PEPT-HA. If we are talking about the pure treatment with DNA PEPT-HA, when we are using just this product, it is recommended to do 4 sessions with 1-2 weeks interval. And it will depend on you, on the specialist, which kind of intervals you will follow. Because if the patient really have severe symptoms of aging, if the skin is really damaged, then the intervals could be shorter, like 1 week would be enough. If this is the product for maintenance of some kind of the treatments which you've already had performed for the patient, if you would like to prevent some kind of if you want to prevent aging, you're working with the young patient, middle-aged patient, with the patient, if you're working with the patient who is regularly doing their treatments, then 2 weeks would be enough. In the clinic, we are performing treatment with the microneedling or sonophoresis with DNA PEPT-HA, and for the maintaining of the result, which you've already obtained, of course, we recommend to patient to use some home care. That would be Sublime Night Cream and Urban Day Cream SPF 20. And if you know, these products are the products of the epigenetic line. So it means that in this product, we do not have just active ingredients. We also additionally have specific epigenetic ingredients, which means that we can influence some kind of activation of some kind of genes. This is the principle of the work of epigenetic ingredient. And all the products in the Epigen line have these specific epigenetic ingredients. Mostly their goal is to protect the cells from the damage and stimulation of synthesis of the collagen. So in this way, your patient can maintain the results that you already achieved due to the treatments that you have done in the clinic. But of course, you can use DNA PEPT-HA, not just the mono treatment. You can use it in some combinations that I will show you now. And you can use it also in the specific technique, which also we will talk about. First of all, I would like to start with the Exoglam protocol, because this is the combination of DNA PEPT-HA with Innoaesthetics Exoskin. You know that when we launched Innoaesthetics Exoskin, we were receiving a lot of questions regarding if it's possible to use for the reconstitution of Innoaesthema, not the saline solution that we have in the kit, but another product of the TDS line. And in order to say yes, we can or no, we cannot, we had to conduct clinical trials. So already before we had a webinar about the combinations of Innoaesthetics with matrix, restructurer, and TIGF. And today I would also like to say that additionally to that TDS products, you also can reconstitute Innoaesthetics excess skin with DNA PEPT-HA. And of course, such kind of protocol will be extremely effective, will be the potential of the stimulating properties of the complex of these products is extremely high, because Innoaesthetics excess skin is the signaling molecule, is the exosome-like product which will stimulate synthesis of collagen. And here, additionally, we are giving our skin the nutrient, the building material for the new DNA. That's why such kind of treatment can be really an option and a new tool for you while working with the patients with the mature skin, with the damaged skin, or for example, of course, we can use it in the case of the prevention of aging, but in the case of prevention, we can use less treatments, for example. Such kind of combination will consist of 4 sessions. There would be 3 sessions of the combination of Innoaesthetics skin with DNA PEPT-HA, and there would be 1 last session with DNA PEPT-HA. Here, I would recommend the interval of 2 weeks, because from my point of view, there is no sense to do it more quickly, because we need some time for the stimulation, and we need some time for the response of the tissues towards this stimulation. That is why mainly 2 weeks would be enough, like the interval for the patient. I will show you the reconstitution. Again, we will use microneedling for such kind of treatment. And in order to support the effect and to maintain the results already obtained professionally, we recommend to our patients at home to use products from Innoaesthetics line, Age Perfection Serum and Antiox Serum. These are 2 serums from the Epigen line. In the Antiox serum, we have mostly antioxidants. So this is the great product for smokers, for the patients whose skin who are living in the polluted areas, for example, after some kind of intoxications, those who have the symptoms of photoaging, and for the patient with the mature skin, with deep wrinkles, with thin skin, we can use Age Perfection Serum, which has anti-aging properties. So mainly we use it when we already have the symptoms of aging, and mostly not for the prevention. So now let's see the protocol of treatment. Here we will combine DNA PEPT-HA with Innoaesthetics skin. As you can see, we do not use saline solution. So already, if you decided that you will use the combination of TDS with Innoaesthetics, you will not need the saline solution for reconstitution. For the reconstitution, we will use the whole vial of DNA PEPT-HA. That would be 2.5, we will use 2.5 milliliters. Not more, because sometimes we are getting questions like, would it be possible, for example, I would like to work with several areas, not just with the face. If you're gonna work with the several areas and you understand that 2.5 milliliters is not enough, of course you can take more, but not just the more of TDS. We need also the second vial of Innoaesthetics skin, because while adding more product than 2 or 2.5 ml to Innoaesthetics skin, we are a bit losing the concentration of Innoaesthetics. here, for example, we can see the treatment which is conducted for a patient with a hypersensitive skin. So that's why it's very delicate, it's rather superficial. The depth of the application in this case is about 0.2 millimeters and not deeper. But as a specialist, you can evaluate the type of the skin, the problems of the skin. And if you're working with the patients with hyperkeratosis, with rather thick skin, not sensitive, with the deep wrinkles, or maybe with the post-acne scars, in that case, of course, you can use it more deeply, around up to 0.5 millimeters. These are the results of the clinical trials of the combination of DNA PEPT-HA with Innoaesthetics skin, and you can see improvement regarding the quality of the tissues, less depth of the fine lines, and these, in my opinion, these are great results. This is pictures, both of the pictures before, and these are the pictures after. So here was used again the combination of DNA peptide with Innoaesthetics skin, and the lightening effect is really amazing, the regenerative and anti-inflammatory effect. So such kind of treatment can be for you an additional treatment in case when you're working with the patients with the hyperpigmentation or post-acne scars. Again, patients with the improvement of the quality of skin. So Exoglam is the new tool for you, which really has a lot of indications and can be very effective treatment in your everyday practice. And also I would like to show you exclusive techniques which were developed in combinations with Innoaesthetics laboratory, and these are the scar reverse technique and RI technique. Let's see the main advantages and the main peculiarities of this technique. Scar reverse technique, which was developed by Anna Tsevrovska, is the technique which will combine positive and negative stimulation. So here we will use DNA peptide like a positive stimulation, and we will use peeling skin recovery like a negative stimulation. First of all, let's see what means positive and negative stimulation. Positive stimulation means that we are applying something that will be a source of the building material or which will directly stimulate activate fibroblast and stimulate synthesis of collagen. We've already discussed with you that polynucleotides is just that ingredient which will be both the source of the building material and the stimulator of the fibroblast. What means negative stimulation? Negative stimulation means that at the end we are obtaining collagen, but we are obtaining that through inflammation. So they work in a different way. That's why in this case, DNA peptide will be a positive stimulation. We will also use mesh scars like the filler, which will inject directly under the scar in order, let's say, to plump the skin up, and it will help to camouflage the scar. It is extremely effective when we are working with a patient who have scars for a lot of time, for a lot of years, when we don't need just the stimulation for the reorganization of the tissues, when we additionally need something that will plump the skin up. And mesh scars is the perfect filler for that. From all the mesh line, from all the mesh fillers, mesh scars is the softest filler. So it means that the level of cross-linking here is rather low. And that's why hyaluronic acid that we have inside, of course, it's cross-linked, but at the same time, it has some kind of the stimulating capacity. Not as strong as DNA peptide, but still, additionally, we are not just the camouflaging the scar. We are also stimulating the reorganization of the tissues. And negative stimulation, which will be peeling skin recovery. Peeling skin recovery is based on azelaic acid and salicylic acid. That's why we will stimulate while applying this, while applying skin recovery, we will stimulate the pro-inflammatory cytokines, and due to this stimulation, again at the end, we will get the effect of the synthesis of the new collagen, mostly because of the damaging of the old collagen by activating proteolytic enzymes. And like the second cascade of the reaction would be the stimulation of synthesis of collagen. The treatment protocol, of course, will depend on the severity, on the depth of the scars, but usually it consists from 3 to 5 sessions. And now let's see the treatment. So first of all, we will apply DNA PEPT-HA with microneedling. The specialist can evaluate the depth of the application. Usually it's between 0.2 to 0.5. In the areas of the scars, you can do it even deeper. So in this way, we are stimulating the tissues. More precisely in the areas of the scars, more superficially in the sensitive areas, in the areas of cupirosis, if patients have. Here patients also has barcodes. That's why we are working more precisely here. The technique of using of microneedling can be different: linear technique, spiral technique. Okay. So in this way, we are working with the whole face. Also, if needed, it can be applied also in the neck area. After that, we will use mesh scars. Filler, specific filler for the treatment of mostly of post-acne scars. It should be atrophic scar, very soft filler. Which is applied just under the scar. Also, it can be applied in the area of, here she has, if you can see, the patient has a scar. But if you already worked with all the scars of the patient and you still have some filler, it would be okay if you will use it locally for some wrinkle.
رقم خدت أنا عند مركز سنتر نزلت أنا وصلت 209 هي منزلة اليهال almost 3. خدت 50 دقيقة لين بيت ماما من مرتفقية.
Раухи, в углу я вот здесь вот поставила, как в нашем, это, как выезжать в Димотап.
تزوجت.
It can be used both intradermally or subdermally. By the way, this technique you also can use in the case of stretch marks. In the case of fibrosis, you will need some subcision in this area. Sometimes when the scars are not deep, even one session would be enough. Because it will plump up just after one session. Or for the other patients with the deeper scars with more fibrosis, more treatments like 3-5 sessions are needed. And the last step of the protocol is using skin recovery. Skin recovery is a peeling based on salicylic and azelaic acid. It's the layer-dependent peeling, which means that the more layers we will use, the deeper it will get in the tissues. So it's not time dependent. There is no sense to wait for 15 minutes, 20 minutes. It will not go deeper unless you will apply the second layer. In this case, we already applied microneedling. That's why for the most of the patient, one layer of skin recovery would be enough. If you want to go deeper in some areas, like in the areas of the scars, locally, just in the area of the scar, you can apply more layers. But overall, for all the face, the average quantity of layers in this treatment would be 1. And of course, we finish the treatment with skin repair and sun protection. So So this is the effect which you can obtain due to scar reverse. If you can see, it's a more smooth skin, less evident scars. This is also the patient who had the scars for a lot of years, post-acne scars. Of course, she has hyperkeratosis, her skin is very thick, but at the same time, it's much more smoother after the treatment. And like I've already mentioned, it also can be used in the case of stretch marks. The other technique, which I developed in collaboration with Innoaesthetics, is RI technique, a specific technique for the treatment of the periorbital area. Because I'm sure you know that periorbital area is one of the main demands of the patient. We have, at Innoaesthetics, we already have really a lot of techniques like triple R technique, VPA technique, which are really great techniques for the treatment of mainly lower and middle third of the face. And now we have the opportunity to combine these techniques with RI technique, which the technique of the treatment of periorbital area. In this technique, I combine the stimulative potential of DNA PEPT-HA with hydrative and scaffold potential of moist. So actually here we work for the improvement of the quality of skin with the help of DNA PEPT and microneedling. And also we are improving the contouring of the periorbital area due to work with moist in the CE moist in the projection of the ligaments and with the help of the fan technique in the area of the temples. The protocol will have from 2 to 4 sessions, depending again on the severity of the problem, depending on the age of the patient, depending on the indications. For some patients, more younger patient, we will need just 2 sessions. For more mature skin and more evident symptoms of the aging of periorbital area, we will use up to 4 sessions, and they can be applied again in 6-9 months. So now let's see the protocol of the treatment. It's the new technique, that's why, of course, we will have a separate webinar just about the technique. But even from the video, you can understand which steps we will have here. The first step is using of DNA PEPT-HA. For the periorbital area, we will need 1 milliliter. So the other amount of product you can use for the whole face, because rarely patients are coming just for the periorbital area. It's like the part of the treatment, but not the only area for the treatment. In these techniques, we will use cannula for fan technique in the temple region, and we will use needle for the creating columns in the projection of the retaining ligament, and also needle for the papule technique in the area of the upper and lower eyelid. For the whole face, we will use whole syringe, 3 ml of INNO moist, which means that for one side we need 1.5 ml of the product. This fan technique with the cannula gives us some kind of lifting effect. Then the supporting part of the technique, when we inject INNO moist, like a columns, vertical columns, in the projection of the retaining ligaments in order to strengthen the tissues in this area. And more superficial injection, papule technique, more superficially around the eyes. Here our goal is to obtain moisturization and hydrating of the thin tissues of the upper and lower eyelids. Moist C has a great moisturizing capacity. And the skin of the periorbital area is very delicate and thin. That's why it was chosen as the product for this technique. And here are some results after clinical trials, after using of this technique. So you can see the significant improvement of the tissues in the periorbital area. The malar groove is much less visible. Here, a significant improvement regarding the wrinkles. Crow feet are much less visible. And in the case, even when we are working with the young patients, we can prevent some kind of aging of periorbital area. And the main improvement we can see regarding the superficial fine lines and wrinkles in the periorbital area. Again, improvement of the malar groove. So we will have a webinar when we will talk just about RI techniques. So there I will explain all the dosages, all the amount of the product per point, how we map the face, the main indications or contraindications for that kind of technique. But now I would like just to pay your attention that there is such a kind of technique that already you can implement into your everyday work with the patients. And also, I'm very proud to share with you that Victor Garcia Guevara, together with Gladys Velasco and Dr. Nancy Diaz, have published clinical trials regarding using of INNO TDS DNA PEPT-HA using sonophoresis. And in these clinical trials, there were 50 female patients of the middle age 47 years. Mostly the indications for treatment were facial wrinkles, skin laxity, dry skin. For all the patients were applied DNA PEPT-HA, 6 sessions with the interval 7 days, and then the comparison of the treated areas with untreated areas were conducted. And after 6 sessions, really great results were obtained. First of all, like we already discussed, we could see the decrease in the melanin index, which means the really great efficacy of DNA PEPT-HA regarding the suppressing of the inflammation, which leads to lightening effect, and improvement regarding the elasticity and luminosity of the skin after these 6 sessions. So it's really it is proven that the product is really effective. It's rather easy to use because you can see that, for example, these clinical trials were conducted with the help of sonophoresis. So even with the non-invasive treatments, we can get such great results. It's completely safe. The patient will not have any kind of risk of bruising or swelling, and it proves the efficacy of the combination that we have in DNA PEPT-HA, the combination of polynucleotides with peptides, with glutathione, and with hyaluronic acid. So this was the mainly all the basic information that I was gonna share with you today. And now, please, if you have any questions, we can discuss them in the chat. Is Hexaglam combination treatment also possible with RF microneedling? If yes, do you recommend application after the needling or apply first and then needling? How does it work in combination with heat from radio frequency? Yes, just because of the heat, we recommend to use Hexaglam after needling. So after you applied radiofrequency microneedling topically, you can apply protocol exoglam. And that would be the great stimulation of the regeneration, because RF microneedling treatment is some kind of traumatic treatment, let's say. That's why you're not just obtaining the anti-aging, additional anti-aging effect, you also stimulate the regeneration and you prevent any kind of side effects after such a treatment. How much ml of DNA PEPT-HA should be reconstituted with the eczema? 2.5 milliliters of DNA PEPT-HA. We have, so the whole vial, 2.5. There was no aspiration during the application of the filler. Is the risk of vascular occlusion? If so, in these videos, now I understand that you could see the videos. In this video, we used only one filler. It was Mesha scars, and Mesha scars was used very superficially in the depths of the dermis. So here we did not use the aspiration. In the RI technique, maybe you mean IR technique, we were not using filler. We were using INNO Moist, which is a biorevitalizer. And with INNO Moist, we are not using the aspiration either. We are just injecting very slowly. So mostly the most unpleasant thing that can happen would be a bruising after using that, because we are using the vertical injections. Skin recovery can help stretch mark case. How about tracer? How technique do you use for severe stretch marks with tracer products in your experience? Thank you. Well, in any case, while if you are working with the severe stretch marks, which exist for a long period, the stretch marks are white. I mean, the color is white, so it's not bluish, it's not reddish. They can be rather wide. In that case, I would say that, of course, just skin recovery with the stimulation with the DNA PEPT-HA would not be enough. The only thing that you can achieve, the only effect that you can achieve is an improvement of how the stretch marks look like, not to significantly reduce them. It's just in the case when you're working with the bluish or reddish stretch marks, rather thin. In that case, you really can significantly improve the quality of the tissues in that area. But in any case, we have to remember that stretch marks is also the type of the scars. So it's a significant damage of the tissues, which sometimes need more aggressive treatments like laser treatments. The protocol for the eyes, can these be applied with microneedling instead of injections? Well, if we will apply everything with microneedling, it would be completely different protocol. It wouldn't be the technique which I showed you, because in that case, we will work just superficially with the tissues, and the effect, of course, will be different, because here I combine superficial microneedling application of DNA PEPT-HA with a deep injection of moist, which is based on high molecular weight and high concentration hyaluronic acid, which helps us to create the scaffold in the area of the preaction of the ligaments. That's why you can apply it with the microneedling, but it would be completely different application and protocol. We can use DNA PEPT-HA with the other injectors. Well, as for the injectors, it is important to understand that everything mostly depends on the regulations in your country, because here in our webinar there are doctors from different countries, and in some countries we can use DNA PEPT-HA, like the mesotherapy products. In some countries, it can be used just for the microneedling. That's why it is up to you or up to the regulations in your country. The most important that you have to understand is that the product is sterile, and that like personally me and a lot of other doctors have the experience of using that like a mesotherapy treatment. In my country, most patients have very sensitive skin due to high UV, weather, and lack of sunscreen protection. To treat sensitive skin with melasma, do you still recommend using peeling plus restructure? What your protocol would be? Well, that's a bit maybe not the question for this webinar, because to answer this question, we need one more webinar. But in any case, we have to understand that peeling plus restructure, for example, peeling with retinol like lightning, or peeling with peeling like meline, is something which is the most potential in the treatment of hyperpigmentation, because it will cover all the steps of melanogenesis. Then, if you're asking if it's still safe to use it for the patient who is not responsible, of course, it wouldn't be very safe, because if the patient do not use sun protection, if the patient do not follow all the recommendation and do not follow the home treatment, which you recommend after professional treatments, then we know that this hyperpigmentation can be even worse after such kind of treatments. That is why, in case with these patients, in case of this situation, you can switch to completely more safe protocols, like using of Hexaglam protocol, which I've showed you. So combination of inner exoskin together with DNA PEPT-HA also will give you lightening effect due to the suppression of the inflammation. It will low down the process of inflammation. It will inactivate or low down the synthesis of pro-inflammatory cytokines. That is why it will give you effect more slowly that you will get with the peeling, but at the same time it would be completely safe. And additionally, what you can do apart from Hexaglam, which I've showed you today, that can be even biorevitalization with INNO Moist, because here we have very high concentration of hyaluronic acid of very high molecular weight. And such kind of hyaluronic acid additionally has anti-inflammatory potential. So keep in mind that it could be for you the alternative for such kind of patients which you described. Of all peels, why is skin recovery chosen for scar treatment? What ingredient will help to stimulate collagen? In skin recovery, we have salicylic acid, we have azelaic acid, and we have low concentration of retinol. So that's why mostly this peeling we are choosing for patient with both acne and post-acne. With the acne, we choose it because it has very strong anti-inflammatory potential. I would say that skin recovery is peeling #1 that we are using for the patient with the acne. In order to use it for the patients with the scars, we can use or more layers, for example, because its keratolytic potential is very strong, and the skin after such kind of treatments will be more smooth. For the stimulation, that would be, of course, mostly DNA PEPT-HA, but skin recovery will support this effect. That's why in this specific technique and scar reverse, mostly we are using just one layer because I explained before we already have conducted the treatment with microneedling. That's why 2-3 layers, that would be maybe a bit more aggressive. But if you are working just with the skin recovery, especially with the fresh post-acne scars, and it's very often when such kind of patients with the fresh post-acne scars have some still have some inflamed lesions, so for them also skin recovery would be one of the top recommendations due to the combinations of anti-inflammatory ingredients like azelaic acid, keratolytic effect of salicylic acid, and some stimulating properties of the low concentration of retinol. I have tried reconstituting DNA PEPT-HA with Innoaesthetics. Do you have encountered cases where severe acne breakout happened after I used intradermal injection? Patient have no active acne. No, I didn't hear about such cases. We used before launching Exaglam, we've conducted clinical trials, and already this is the protocol which was used off-label by the doctors of many countries, so we didn't receive such feedback. But in any case, severe acne breakout can happen in the case of the low immunity of skin, for example, in the case of the damaged skin, because it could be the reaction not for the ingredients that you injected, it could be a reaction just for the injection, for the treatment by itself. Maybe for this patient with the damaged skin, it was rather aggressive. Maybe something wrong was used after the treatment, but of course it's not something that we are expecting, that we can expect from this treatment. How many particles we have in Innoaesthetics? In Innoaesthetics we have 200 million particles in the vial. These are synthetic particles. This is not the human-derived, this is not plant-derived exosomes, not of natural origin. They were bioengineered in the laboratory. That is why 100% of these particles are active. And this is the amount which is enough for the stimulation that we are expecting from Innoaesthetics. What are the worst possible side effect beside allergy? Depending on the treatment, but if we are talking about the products itself, we are not expecting any side effect beside the allergy, which is very specific depending on the patient, because you know that it's possible that the patient can have allergy towards whatever. And if we are talking about the protocols that we were discussing today, talking about injections, if we use a needle, that could be bruising, for example. Sometimes it can be maybe light. Again, if we are using with microneedling, we will never get the effect of swelling. But if you use it like off-label, with the mesotherapy techniques, in the case when the patient is prone to swelling and a lot of product was injected in the area, like periorbital area, for example, more than it is recommended, then it can be swelling for a day or 2 days, but not more. And also it's not something common. It just, if you have it, you don't have to be afraid of that. It's the normal reaction of this specific patient who is prone to swelling, or maybe you injected a bit more of the product. But it's not that you have to worry about all the time, because mainly we use DNA PEPT, and we recommend to use DNA PEPT even in the case when patients are prone to swelling. Stretch marks, white color caused by pregnancy. you can use this treatment, but as I've already mentioned, you have to evaluate how severe the stretch marks, are they really wide? You can start, for example, with the protocols for the stimulation like Exaglam, like I recommended to you, but you will see, is it enough? Because if it's more severe than skin recovery, instead of skin recovery, you can use, for example, peeling TCH based on trichloroacetic acid, 15% of concentration. Not very high, but still very effective and very predictable result. So it's there is no one correct protocol for the treatment of the stretch marks. In any case, you will evaluate like a specialist. Would it be enough for the patient in this case, or you need to use more aggressive treatments? To order the products, you can get in contact with the distributor in your country. The concentration of PDRN per vial is 1%. What is the specific molecular weight of hyaluronic acid in the DNA fragments? Well, there is no hyaluronic acid in DNA fragments. DNA fragments are polynucleotides, and in our product DNA PEPT-HA, we have combination of polynucleotides with hyaluronic acid. If you're interested in the molecular weight of hyaluronic acid here, it's less than 1 million Dalton, almost 1 million Dalton, not higher. 1%, 1 million. Okay, I think we've had all the questions. In any case, if you have any other questions, you always can keep in touch with your distributor who can connect with us, and of course we will provide all necessary information. Also here in the chat you can see our mail, which is the mail of Skin Academy, where you can write directly, and again we will be happy to provide you all necessary information. We've got one more question. How deep can DNA PEPT-HA applied? If we are talking about the micro needling, the depth of the application would depend on the indications. So if you work with the scars, if you work with the skin with the hyperkeratosis, with the deep wrinkles, if you work with the body, you can apply it up to 2 millimeters. So that is not a problem because of the completely safe concentrations in the product, and the product is of course sterile. But for more sensitive skin, for the skin which is prone to cupirosis, for the young skin, when we are just working for the prevention of some kind of aesthetic issues, that could be more delicate treatment of 0.2 millimeters. It is not recommended to mix DNA with any other TDS, and I would say that it is not recommended to mix any TDS with another TDS, because it's already, all of these products are a mix of some kind of ingredients, and you don't know which will give you this combination of these ingredients together in one syringe. That is why when we are recommending to mix, for example, Innoaesthetics skin with other TDS, we can recommend it because we conducted trials with the combination of that mix, so we know that it would stay active, that there wouldn't be any problems regarding the osmolarity of the product, regarding the pH of product, and so on. And in Innoaesthetics skin, we would say that this is like a mono product, because inside we have just these specific exosome-like particles. All the TDS, all the other TDS products, they are a mix of active ingredients. That is why it is not recommended to mix them together, but still you can use two different products, two different TDS products during one session, but in different syringes, in different areas maybe. Yes, and I've just explained about Innoaesthetics with DNA. Innoaesthetics is considered to be a monoproduct with exosome-like particles, and we've conducted all necessary clinical trials to check the efficacy, to check the pH and osmolarity of the product after the reconstitution. Okay, thank you very much for your attention. Thank you very much that you've been with us in this webinar. I hope to see you soon in our future webinars, and I hope that it was rather useful for you, that you will be able to apply these protocols and techniques in your everyday practice. So looking forward to our new meetings, and have a nice day. Bye.